Hi, we are the Atorvastatin, an HMG-CoA reductase inhibitor. In this video, we will be talking about my autobiography. That will include my drug name, such as my generic name, brand name, and chemical name. We will also be talking about my drug classification, including my therapeutic and pharmacologic classification. We will also include about my pregnancy category, mechanism of action, pharmacokinetics, indications, contraindications, side and adverse effects, and the nursing responsibilities before, during, and after my administration. But before we proceed, let me give you an overview of what I am. So, what is atorvastatin? Atorvastatin belongs to a group called statins. These are the anti-hyperlipidemic drugs, also called as lipid-lowering agents, which are drugs affecting the cardiovascular system. I am used, along with proper diet, to help lower bad cholesterol and fats such as the LDL and the triglycerides, and I raises good cholesterol or the HDL in the blood. Now, let me formally introduce myself. Hi, I am Atorvastatin. That's my generic name. If you wish to find me in the pharmacy, you can look for Lipitor. That's my brand name. Chemically, I am known as C33H35FN2O5. Next, let's talk about my drug classification. For the therapeutic classification, I am classified as anti-hyperlipidemic, and for my pharmacologic classification, I am classified as HMG-CoA reductase inhibitor. I belong in the category X of the pregnancy category because it has been known that I may cause fetal harm during pregnancy. For my mechanism of action, the atorvastatin is a synthetic lipid-lowering agent, an inhibitor of 3-hydroxy-3-methylglutaryl coenzyme A, or HMG-CoA reductase. This enzyme catalyzes the conversion of HMG-CoA to mevalonate, an early and rate-limiting step in the cholesterol biosynthesis. Atorvastatin also increases the number of LDL receptors on the surface of the hepatic cells. Next, let's talk about my pharmacokinetics. I am rapidly absorbed after oral administration with a peak plasma concentration at 1 to 2 hours. My bioavailability is low, which is at 14% due to the extensive first-pass metabolism. For my distribution, I am highly plasma protein bound, over 98%, and has a volume of distribution of about 380 liters. I am metabolized by the cytochrome P450, 3A4, or the CYP3A4 to active ortho and parahydroxylated metabolites. I, together with my metabolites, gets excreted in the bile. It is not known that I go through enterohepatic recirculation. My half-life is about 14 hours, while my active metabolites have half-life of about 20 to 30 hours.
And now, I will continue to discuss what are my indications, contraindications, my adverse effects, and my nursing responsibilities. As an atorvastatin, I am indicated for the treatment of several types of dyslipidemias, including primary hyperlipidemia and mixed dyslipidemia in adults, hypertriglyceridemia, primary dysbeta-lipoproteinemia, homozygous familial hypercholesterolemia, and heterozygous familial hypercholesterolemia in adolescent patients with failed dietary modifications. I am contraindicated to a person who are hypersensitive to any of my components. and also to the patient who has active liver disease or unexplained transaminase elevation, also to a woman who are pregnant or breastfeeding, and lastly, the doctor should not give this medication if patient has liver problems. The following are my adverse effects. In the digestive system, abdominal discomfort, diarrhea, eructation, flatulence, hepatitis, cholestasis, liver problems such as upper stomach pain, weakness, tired feeling, loss of appetite, nausea, and jaundice. In musculoskeletal system, musculoskeletal pain, muscle fatigue, neck pain, swelling of the feet, limb pain, ankles or joints, pain in legs or arms. Metabolic and nutritional system, transaminases increase, liver function test abnormal, blood alkaline phosphatase increase, creatinine phosphokinase increase, and hyperglycemia. In the nervous system, nightmare and insomnia. In the respiratory system, epistaxis, cold symptoms such as runny or stuffy nose, mouth and throat pain, shortness of breath, and other breathing problems. In the skin and appendages, urticarial. In the special senses, vision blurred and tinnitus. In the urinary system, little or no urinating, white blood cells urine positive, dark urine, and urinary tract infection. Body as a whole, malaise and pyrexia. Nursing responsibilities before, during, and after. Assess the following before giving atorvastatin: the history, any allergy to atorvastatin, fungal byproducts, active hepatic disease, acute serious illness, pregnancy and lactation. Also assess the physical, like orientation, affect, muscle strength, liver evaluation, abdominal examination, lipid studies, LFTs, and renal function tests. Warning: ensure that patient is not pregnant and has appropriate contraceptives available during therapy. Serious fetal damage has been associated with this drug. During administration, the nurse should obtain LFTs as a baseline and periodically during therapy. Discontinue drug if AST or ALT levels increase to 3 times normal levels. Warning: withhold atorvastatin in any acute, serious condition or severe infection, hypotension, major surgery, trauma, severe metabolic or endocrine disorder, and seizures that may suggest myopathy or serve as risk factor for development of renal failure. Ensure that patient has tried cholesterol-lowering diet regimen for 3 to 6 months before beginning the therapy. Administer drug without regard to food, but at the same time each day. Atorvastatin may be combined with a bile acid binding agent. Do not combine with other HMG-CoA reductase inhibitors or fibrates. Consult dietitian about low cholesterol diets. After, the nurse should help educate to take the drug once a day, at about the same time each day, preferably in the evening. May be taken with food. Do not drink grapefruit juice while taking this drug. Institute appropriate dietary changes and arrange to have periodic blood tests while you are taking this drug. Alert any healthcare provider that you are on this drug. It will need to be discontinued if acute injury or illness occurs. Do not become pregnant while you are on this drug. Use barrier contraceptives. If you wish to become pregnant or think you are pregnant, consult your healthcare provider. The nurse should assess if the patient may experience the following side effects: nausea, eat frequent small meals, headache, muscle and joint aches and pains that may lessen over time. Report muscle pain, weakness, tenderness, malaise, fever, changes in color of your urine or stool, and swelling.